be talking about some aspects of maxillofacial CT anatomy today. So maxillofacial imaging in clinical practice, the indications can be facial trauma, evaluation of various sinus, orbital or other facial pathology, non-specific facial pain, pre-operative planning for functional endoscopic sinus surgery, or post-operative follow-up. The regions of the face are nasal, orbital, zygomatic, maxillary, and mandibular. Facial anatomy is a face is a complex structure formed by 14 bones. There are 6 paired bones: the lacrimal, zygomatic, maxillary, nasal, inferior nasal concave, and the palatine bones. There are 2 unpaired bones, which are the vomer and the mandible. The facial buttresses are 4 pairs, each of horizontally and vertically oriented struts. The vertically oriented struts directly or indirectly connect the anterior facial skeleton to the posterior skull base. Coming to the horizontal buttresses, there are 4. The upper transverse maxillary buttress originates at the level of the nasofrontal suture and extends along the inferior edge of the orbit across the zygomatic bone to the zygomaticofrontal suture. This buttress extends posteriorly as the orbital floor. The lower transverse maxillary buttress is oriented horizontally along the maxillary alveolar process and extends posteriorly to include the hard palate. The upper transverse mandibular buttress includes the mandibular alveolar process and extends from its posterior margin through the mandibular ramus to the posterior cortical margin of the mandible. The lower transverse mandibular buttress is the inferior margin of the mandible. The vertical buttresses include the medial maxillary buttress, which extends from the nasofrontal suture along the lateral margin of the piriform aperture to the maxillary alveolar process. It extends posteriorly to include the medial orbital wall and the medial wall of the maxillary sinus. The lateral maxillary buttress begins at the zygomaticofrontal suture and projects inferiorly along the lateral orbital rim through the body of the zygomatic bone across the zygomaticomaxillary suture and terminates in the maxillary alveolar process adjacent to the posterior maxillary molars. The posterior extensions of this buttress are the lateral orbital wall and the lateral maxillary sinus wall. The posterior maxillary buttress is formed by the pterygoid plates, which connect the sphenoid bone to the maxilla and are an important site for the craniofacial dissociation fractures, that is Leafold's fractures. The posterior mandibular buttress is the posterior margin of the mandible and includes portions of the ankle, ramus, and the mandibular condyle. The facial buttresses have sufficient bone thickness to accommodate metal screw fixation. They are all linked either directly or through another buttress to the cranium or the skull base as a stable reference point. The transverse buttress reduction restores the facial profile width, and the vertical buttress reduction restores the facial height. This is a picture shows the horizontal and the vertical buttresses. This is the upper transverse maxillary buttress, then the lower transverse maxillary buttress, the upper transverse mandibular buttress, and the lower transverse mandibular buttress. The vertical buttresses, which include the medial maxillary, the lateral maxillary, the posterior maxillary, which is partly seen, and the posterior vertical mandibular buttress. Coming to the orbit, it is conical in shape. The roof is formed by the frontal bone and the lesser wing of the sphenoid near the apex. The medial wall is formed by the ethmoid sinus complex, that is the lamina pepracia, which joins the lacrimal bone anteriorly, which merges with the frontal process of the maxilla The lamina pepratia joins the lateral wall of the sphenoid sinus posteriorly. The lateral wall in the anterior one-third is formed by the orbital process of the zygomatic orbital surface of the zygomatic bone, and the posterior two-thirds by the greater wing of the sphenoid. The floor is the maxillary sinus roof. Posteriorly, the inferior orbital fissure separates the maxilla and the greater wing of the sphenoid. The zygomatic arch, the zygomatic bone, constitutes part of the lateral orbital walls inferior to the frontal bone. The zygomatic bone has two processes, the frontal process, the temporal process, which connects with the zygomatic process of the temporal bone to form the zygomatic arch. The zygomatic bone is connected to the rest of the facial skeleton and calvaria by 4 sutures, the zygomatico-frontal, zygomatico-maxillary, zygomatico-temporal, and zygomatico-sphenoid sutures. This is a 3D CT showing the zygomatic bone and the 4 sutures, the zygomatico-frontal suture, the zygomatico-sphenoid suture, zygomatico-maxillary suture, and the zygomatico-temporal suture. The mandible is a U-shaped bone connected to the calvaria through the temporomandibular joint, creating a ring-like structure. The parts include body, ramus, ankle, coronoid process, and the mandibular condyle. Because of the ring configuration of the mandible, a traumatic blow typically results in at least 2 discrete fractures. This is a picture showing the parts of the mandible, the mandibular condyle, the coronoid process, the ramus, the angle, the body of the mandible, the parasymphyseal region, and the alveolar process. The paranasal sinuses are the frontal, ethmoid, maxillary, and the sphenoid sinuses. The frontal is the last to pneumatize. The ethmoid sinuses grow and pneumatize up by 12 years of age. Maxillary sinus is the first sinus to form. The sphenoid sinus pneumatizes from 7 months to 2 years and is complete by the 2nd decade. The middle turbinate, it attaches superiorly to the cribriform plate via the vertical lamella and to the lamina pepratia via the basal lamella. The gap between the ethmoid bulla and the basal lamella is known as the sinus lateralis, and it opens into the middle meatus. Frontal sinus may be over-pneumatized or hypoplastic. The drainage pathway is through the frontal recess, which is bordered by the agar nasi cells anteriorly, the lamina pepratia laterally, and the middle turbinate medially. It drains into the ethmoid infundibulum if the anterior uncinate process attaches superiorly to the skull base, which then communicates with the middle meatus via the hiatus semilunaris. If the anterior uncinate process attaches to the lamina pepratia, then the drainage of the frontal recess is directly to the middle meatus. The maxillary sinus, it drains into the infundibulum, which joins the hiatus semilunaris and drains into the inferior meatus. The uncinate process attaches inferiorly to the inferior turbinate. The ethmoid infundibulum is bound laterally by the inframedial wall of the orbit, superiorly by the hiatus semilunaris, ethmoid bulla, and medially by the uncinate process. The hiatus semilunaris is the gap between the uncinate process and the ethmoid bulla and is the final segment of drainage pathway from the maxillary sinus and ethmoid infundibulum. It communicates medially with the middle meatus. This is the picture of the osteomeatal unit, which shows the maxillary sinuses, the ostium of the maxillary sinus, the ethmoid bulla. This is the basal lamella of the middle turbinate. The space between the ethmoid bulla and the basal lamina, which is seen as the sinus lateralis. Here we can see the uncinate process, the ethmoid infundibulum, and the hiatus semilunaris. So the osteomeatal unit is comprised of the frontal sinus ostium, the frontal sinus drainage pathway, maxillary sinus ostium, infundibulum, and the middle meatus. The ethmoid sinus is divided into groups of cells by bony basal lamellae. The most important is the basal lamella of the middle turbinate, which separates the ethmoid into the anterior and posterior ethmoid air cells, what we saw in the previous picture, the basal lamella. The anterior ethmoid drainage is to the hiatus semilunaris and the middle meatus. The posterior ethmoid drainage is to the sphenoethmoidal recess and the superior meatus. This again shows the coronal and the sagittal views of the paranasal CT images of the paranasal sinuses, the middle and inferior turbinates, the basal lamella and the vertical lamella attachments of the middle turbinate, the cribriform plate, the ethmoid air cells, the perpendicular plate of the ethmoid, and that is the nasal septum, the maxillary sinus, the hard palate, and again the sagittal view, which shows the frontal sinus, the frontal recess, the agar nasi cells, the anterior most ethmoid air cells, the anterior and posterior ethmoid air cells, the sphenoethmoid recess, the sphenoid sinus, the middle and inferior turbinate, the hiatus semilunaris, the ethmoid bulla, and the middle meatus. The sphenoid sinus can have a variable pneumatization. The pneumatization can extend to the greater sphenoid wing, resulting in the lateral sinuses. It can also involve the posterior orbital wall, the pterygoid processes, and the lesser wing of sphenoid. It drains into the sphenoethmoidal recess and into the superior meatus. Coming to the sectional anatomy of the face, the soft tissue sections of images of the axial CT sections. Anteriorly, we can see the maxillary sinuses, the infratemporal fossa, the coronoid process, the mandibular condyles, the lateral pterygoid muscle, the temporalis muscle, the masseter muscle, the fossa of Rosenmuller, the nasal septum and the nasal vestibule, the external auditory canal. Again, here we can see the hard palate, the anterior nasal spine, the maxillary sinuses, the infratemporal fossa, the temporalis muscle, the masseter muscle, the lateral pterygoid muscle, the lateral pterygoid plate, the medial pterygoid muscle, the medial pterygoid plates, the nasopharynx, the parapharyngeal fat, the mandible, the parotid glands, the mastoid, and the styloid process. Again, here we can see the platysma, the mandible, the masseter muscle, part of the mylohyoid muscle, the hyoglossus muscle, then the genioglossus muscle and the lingual septum, the epiglottis base of the tongue, and the sternocleidomastoid muscle, the sublingual space, the coronal soft tissue sections again shows the inferior turbinates, part of the middle turbinates, then the maxillary sinuses, the buccal space fat, the zygomatic arch, the masseter muscles, the temporalis muscle, the part of the tongue, the genioglossus muscle, mylohyoid muscle, the anterior belly of the digastric muscle, and the platysma. Part of the mandible. Further posteriorly, we can see the sphenoid sinus, again the temporalis muscle and the masseter muscle, the coronoid process, zygomatic arch, the buccal fat pad, the buccinator muscle. Then again we can see portion, the hard palate, part of the tongue, mylohyoid and the genioglossus muscle, the geniohyoid muscle, and the anterior belly of the digastric muscle. Further posteriorly, the sphenoid bone, the foramen ovale, the parapharyngeal fat, the lateral and the medial pterygoid muscles, the masseter muscle, the submandibular gland, then the part of the hyoid bone, the ramus of the mandible, the parotid glands, the mandibular condyles, the bony window, the axial sections again show the frontal bone, the frontal crest, the orbital surface of the frontal bone, part of the lesser and the greater wings of sphenoid, the temporal bone and the parietal bone, nasal bone, the part of the frontal process of the maxilla, the orbital surface of the ethmoid bone, the crista galli, the frontal process of the zygomatic arch, and the orbital surface of the zygomatic bone, portions of the greater wing of sphenoid, the anterior clinoid process, famous part of the temporal bone, the prechiasmatic sulcus. The lower sections show the nasal bone, again the frontal process of the maxilla, then the superior orbital fissure and the optic canal. Again the zygomatic bone and the frontal process is seen, the greater wing of the sphenoid, the sphenoid sinus, the tuberculum cellae, the anterior and the posterior clinoid processes, the greater wing of sphenoid, and the parietal and the temporal bones are seen. The inferior section shows the nasal bones, the nasal process of the maxilla, the perpendicular plate of the ethmoid, the ethmoid air cells, the ethmoid bulla, the zygomatic bone, the orbital surface of the maxillary sinus, the part of the greater wing of the sphenoid, the portions of the superior middle and the inferior superior and middle turbinates, the sphenoid sinus, clivus, fetus part of the temporal bones, carotid canal, and foramen rotundum. Again, we can see the nasal bone and the frontal process of the maxilla, the perpendicular plate of the ethmoid bulla, and the portions of the middle turbinate, the posterolateral surface of the maxillary sinus, the zygomatic bone, the temporal bone and the clivus is again seen. The inferior orbital fissure is also seen. Again, here we can see the frontal process of the maxilla, the nasal surface of the maxillary sinus, the vomer, the zygomatic process of the maxilla, the temporal process of the zygomatic bone, again the posterolateral surface of the maxilla, the medial and the lateral pterygoid plates, the head of the mandible, part of the clivus is seen. The inferior section shows the anterior nasal spine, the alveolar process of the maxillary sinus, the lateral plate of the pterygoid, the ramus of the mandible, the styloid process. the C1 and C2 vertebrae. Again, the maxillary alveolus is seen, the pterygoid hamulus, the ramus of the mandible, and the C1 and C2 vertebrae are seen. The coronal sections show the frontal bone, the glabella, the nasal bone, the perpendicular plate of the ethmoid, part of the frontal process of the maxilla, the inferior turbinates, the vomer, the maxillary alveolus, and part of the body of mandible. Again, here we can see the crista galli, the frontal bone, the part of the lacrimal bone, the maxillary sinus, the middle and the inferior turbinates. The vomer is also seen, the body of the mandible and the digastric fossa. Further posteriorly, we can see the cribriform plate, the infraorbital foramen, the Zygomatic-facial foramen, the middle and the inferior turbinates are again seen. The crista galli is seen, the frontal bone, the perpendicular plate of the ethmoid, the part of the zygomatic bone, the frontal process of the zygomatic bone, the ethmoid bulla is seen, and also we can see a part of the uncinate process. The body of the mandible and the submandibular fossa is seen. Further posteriorly, the perpendicular plate of the ethmoid, the cribriform plate, the lesser wing of the sphenoid, frontal bone, the orbital surface of the greater wing of the sphenoid, the zygomatic bone, and the inferior turbinate. The middle turbinate is seen. Part of the mandible is also seen. The vomer is seen. The posterior sections show the optic canal, the superior orbital fissure, the inferior orbital fissure, the sphenopalatine foramen, the perpendicular plate of the ethmoid, the coronoid process of the mandible, the ramus of the mandible, the pterygoid humulus, the mylohyoid line, the part of the body of the hyoid bone, the lesser wing of the sphenoid, the sphenoid sinus, body of the sphenoid, portions of the greater wing of the sphenoid, and the frontal bone is seen. Again, here we can see the optic canal, the superior orbital fissure, the foramen rotundum, the vomer, the greater wing of the sphenoid, the anterior clinoid process, jugum sphenoidae, body of the sphenoid bone, famous part of the temporal bone, the coronoid process, and the ramus of the mandible, and the body of the mandible is seen, and also the part of the hyoid bone is seen. The medial and the lateral pterygoid plates are also seen. Posterior section shows the parietal bone, the dorsum sellae, the posterior clinoid process, the pituitary fossa, the foramen ovale, the zygomatic process, the spine of the sphenoid, the ramus of the mandible, and the body of the mandible. Coming to the anatomical variants, the anatomical variants include the concha bullosa, the agar nasi cell, the paradoxical middle turbinate, the atlectatic or pneumatized uncinate process, halar cell, onodi cell, excessive pneumatization of the sphenoid sinus, aerated crista galli, dehiscence of the lamina pepracia, and posterior nasal septal cell. Concha bullosa is the pneumatization of the middle turbinate, which can potentially narrow the middle meatus, as seen here. There is also pneumatization of the inferior turbinate. The agar nasi cell is the most anterior ethmoid air cells. Their location is anterior, lateral, and inferior to the frontal recess. The frontal recess, which is shown here, is the middle turbinate, and this is the agar nasi cell. The paradoxical middle turbinate, which has a lateral convexity instead of the normal medial convexity of the middle turbinate. The halar cell is the infraorbital ethmoid cells, which are the ethmoid cells that extend downward under the medial floor of the orbit, adjacent to and above the maxillary sinus ostium, lateral to the infundibulum. These are the halar cells, and also we can see the concha bullosa. The Onodi cell or the sphenoethmoidal cells, which are the posterior ethmoidal cells that extend laterally, superiorly and posteriorly to the sphenoid sinus and are closely associated with the optic nerve, shows the Onodi cell with the projection of the with the optic nerve canal seen adjacent to it. The excessive pneumatization of the sphenoid sinus is seen here. The posterior nasal septal cell, that is the air cells in the posterior portion of the nasal septum, which may communicate with the sphenoid sinus. Any inflammatory disease that occurs within the paranasal sinuses can also affect these cells. It can resemble a cephalocele. These are some of the anatomical variants. So some of the references which I used in my talk. Thank you. Any questions?